Good morning, everyone. My name is Robin James, and I am the Development and Marketing Director for Middle Alabama Area Agency on Aging, better known as M4A. And we have a really great CEU webinar this morning called Education Tools That Support Caregivers, the What, Why, and How. And Crystal Whitehead, who is with our agency, will be our keynote presenter this morning. But before I introduce her, I just wanted to go over a few things. Our CEU provider is Carlette Smith, and she is with HR Option Solutions. Her email is there on the screen. You will receive anywhere between 1.5 to 2 CEUs as long as you stay through the duration of the training this morning. So thank you, Carlette, for your support and partnership. I also wanted to recognize Jennifer Fuller. She provides a lot of technical support behind the scenes. She is a registered nurse with our agency, and she is the project director of our PANDA project, which is providing Alzheimer's and dementia assistance. And I also wanted to recognize Jeremy Rains, who's on the call this morning with us or on this webinar, and he serves as our Alabama Cares coordinator, and which is a federally funded caregiver support program. Just some quick CEU housekeeping rules. We've learned a lot through COVID when we started these a little over a year ago. And so you will be required to complete an evaluation, and Jennifer will put the link at the end of this webinar this morning in the chat. And so you will have to submit that to Carlette Smith. And then please make sure that you add your home address and your personal cell home number, not your business address. It's really hard for Ms. Smith to reach out and provide you with your certificate if she doesn't have that good contact information from you. So your evaluation must be submitted within 24 hours after this session this morning. Unfortunately, there are no exceptions to this rule. Ms. Smith will not be unable to provide your certificate, and that actually is a rule by the disciplinary boards of the nursing and administrators nursing board. So it's really not our rule. And so for those of you who are sharing a room or an office this morning, make sure that each person registers for the class and completes the class evaluation, because we want all of you who attend this hour-and-a-half CEU webinar this morning to receive your CEUs. If you phone in and you're not on Zoom this morning, please identify your phone number, and you could put that in the chat so that we can cross-reference who you are. And then anyone who is not registered and their name or phone number is not in the Zoom report cannot receive a certificate. So we just have learned, like I said, and this just makes it much more streamlined, because really it's all about you, the information that you're learning, and to make sure that you get credited where you need to be. So just as a reminder, M4A is one of 13 local area agencies on aging. Every county in the country, and including all 67 in Alabama, is represented by a local AAA, and our overall mission is to help people age in place within their community. Each area agency on aging has an Aging and Disability Resource Center, and that really serves as a single point of entry to receive a full screening for all the programs, services, and resources that consumers of all ages may be eligible to receive. And so anywhere in Alabama, you can call 1-800-AGE line and be connected directly to your local area agency. For M4A, we cover Blount, Chilton, Shelby, St. Clair, and Walker counties. So we have a lot of programs and services available. I know you all heard of Meals on Wheels. It's actually ours is called the Elderly Nutrition Program, which is federally funded. So we do provide frozen and hot delivered meals in a congregate setting, as well as to our homebound clients. This morning, there are Alabama Cares. You'll learn more about that program this morning. We also have medication assistance called Senior RX, which is funded by the state legislatures since 2002. And so we work directly with the pharmaceutical companies, and we can provide no cost or low cost medication assistance. We do no-cost insurance counseling, Medicare counseling specifically. We have a senior employment program, which is for 55 and above, and that we also serve Jefferson County for that particular program. We do have a legal assistance program, and a lot of you who attend these monthly know of Jan Neal. She is our elder law attorney, and she provides that no cost legal services for people that they must be 60 years of age or older. And then we do a lot of elder abuse prevention. We are starting a Center for Elder Justice and Advocacy that will serve as Alabama's Elder Justice Resource Center and will serve our 5-county area. And then we also, our biggest program is the Medicaid Waiver Program, which we partner with Alabama Medicaid Agency. And we also have the Ombudsman Program, which is the advocate for long-term care residents who live in either an assisted living or a nursing home. We do a lot of other programs and services, but these are primarily our core programs. And then our next class, it's going to be Consumer Issues for Seniors and Caregivers. It will be held from 10 to 11:30, August 17th, so you don't want to miss it. And Jan Neal, our elder law attorney, will be the presenter. I also just wanted to let you know that our Panda Project and our Alabama Cares Project, they host monthly coffee breaks for caregivers. The next one will be held July 28th from 1 to 2, and it's all about oral health. So we have partnered up with the UAB School of Dentistry, and 2 of those professors will be the keynote presenters for that. So I really just want to turn this over to Crystal Whitehead and let you know Crystal's been with M4A since 2013, and she received her license to practice social work back in 2003. Prior to coming to M4A, she served years, very important roles with Shelby County Department of Human Resources. And she received her Bachelor's of Science in University of Montebello. And Crystal has a very unique position that M4A created based on her real expertise in this area and working one-on-one, really in the trenches with family caregivers. And so she is a full-time caregiver interventionist. She does a lot of, again, a lot of support in the home for caregivers. And so I'm just I'm delighted that Crystal's a wonderful speaker. She has a lot of great information to share. And Crystal, I'm just going to turn it over to you and stop sharing my screen.
What I'm going to talk about today is some of the innovative caregiver tools, the what, the why, and the how with how we're working to reach caregivers at this interesting stage where over what seemed to be the worst of the pandemic, but it's really changed our focus and how we operate as an agency. So diving right in, when we're talking about caregiver, what are we talking about? There's 2 general types of caregiver. Starting at the bottom here, the formal caregiver is what most of us think about. These are the paid care providers providing assistance with activities of daily living and or medical tasks, either in the home or in a care setting, like a long-term care, assisted living, or a daycare. The problem with the informal caregiver, and it's not really a problem, but it kind of is, we don't always identify as caregivers if we're an unpaid individual like a spouse, a relative, a friend, or a neighbor. We just see that as part of what a mom does, part of what a daughter does, part of what a sister does. So we struggle to identify as caregivers sometimes. But for the purposes of today, we're going to be talking about informal caregivers who assist with the activities of daily living and or medical tasks. So some demographics, and these are a little bit older. I was struggling to find some of the newer ones. I got a lot of census data, but not as much of a caregiver specific breakdown as I did from 2010 and 2015 stats. So what you're looking at is actually about 5 years old for most of it, but approximately in 2015, there are approximately 43.5 million caregivers who had provided care to an adult or a child in the last 12 months. About 34.2 million Americans provided unpaid care to an adult age 50 or older in the last 12 months, and approximately 39.8 million caregivers provide care to adults, that's anyone age 18 or older with a disability or illness. So in other words, 16.6% of Americans are caregivers for adults. About 15.7% of 15.7 million adult family caregivers care for someone who has Alzheimer's disease or another form of dementia. So the toll of caregiving, the what of caregiving, and why we're trying to reach some of the innovative caregiver tools that we'll discuss at the end of it. The mental and emotional effects of caregiving, 40 to 70% of family caregivers have clinically significant symptoms of depression. 20% of employed female caregivers, these are still the family caregivers, not the professional caregivers, but if you're a family caregiver who is employed and you are female, 20% of these caregivers age 50 or older report symptoms of depression, compared to only 8% of females aged 50 plus who are not caregivers. Caregivers whose care recipient has an emotional or mental health problem, they are more likely than others to report a decline in their own health. So if you're a caregiver who's caring for someone with an emotional or mental health issue, then you're 25% more likely to report a decline in your health versus 14% of caregivers whose loved one does not have an emotional or mental health problem. About 40% of family caregivers of people with dementia suffer from depression, compared to 5 to 17% of non-caregivers, and the rates of depression increase with the severity of the cognitive impairment of the person with dementia. Caregivers who work full-time and are aged 45 years or less show the greatest emotional and physical health deficit, in contrast to non-caregivers. Physical effects of caregiving, 17% of caregivers feel their health in general has gotten worse as a result of their caregiving responsibilities. The toll of caregiving worsens over time. In the first year of caregiving, only about 14% are going to report that their health is fair to poor. But if you've been a caregiver for 5 or more years, there's about 20% of people that would report their health to be fair to poor. Caregivers who provide for persons with dementia risk compromising their immune system for up to 3 years after their caregiver experience ends, and this increases their chances of developing their own chronic illness. And the physical and emotional impact of dementia caregiving resulted in an estimated $9.7 billion in healthcare costs in 2014 alone. So Rosalind Carter is known for this lovely statement here. There are only 4 types of people in the world: those who are caregivers, those who will be caregivers, those who need caregivers, and those who have been caregivers. So if you look at the options here, that's pretty much all of us at some point in time are going to end up being caregivers or needing caregivers. So 24% of caregivers are age 18 to 34, 23% of caregivers are age 35 to 49, and 35% of caregivers are age 50 to 64, adding up to roughly 82% of caregivers potentially having to balance caregiving of an adult, like their parents or an elder relative, along with their child rearing responsibilities. Now, this is based off of 2020 census information. 61% of caregivers are employed, 11% are currently students, 88% are living in urban settings, while 12% of caregivers are living in rural settings. You look at the number of care recipients, 69% living in urban settings, while 31% are living in rural settings. So there's a little bit of a juxtaposition in locale. This information would imply, but it's not broken down specifically by caregiver to caregiver and these caregiver to care recipient in these percentages, but it implies that caregivers are facing challenges with balancing time, i.e. the time that they're obligated to be at work or at school, the travel time to get to and from their care recipient, the time it takes to access care for their care recipient, and so on. So as M4A, this is what we are doing, how we're trying to reach out to our caregivers. We've got some virtual and in-person options. I'll go over briefly the in-person options, but most of our options at this time are simultaneously virtual options. So we're going to start with a little bitty clip here, and y'all let me know if the sound doesn't show up.
Welcome to Truealta, a complimentary online service for families caring for aging loved ones. Truealta provides a collection of professional content designed to support you and your loved one. Find activities for connecting with your loved one. Learn about new behaviors and how to best handle them. Discuss your experiences and learn from others. Or find tips on self-care and making time for your needs. A recent study found that 9 out of 10 people who use Truealta would recommend it and gave an overall rating of 4.5 stars out of 5. You can access Truealta on your mobile device or computer, and the lessons are short, typically 5 minutes or less, and support is available when you need it, with contact info for local resources at the top of every page. With Truealta, you'll be confident you're doing your best.
All right, so Truealta is one of our most exciting platforms that we're working with right now. You register for that. You can go to our main website, m4a.org, and then select the Alabama Cares page. And there's a link there to be able to sign up for Truealta. This is specifically for those within our service area, although I know several of the other area agencies on aging have also adapted the Truealta platform as well to help reach out to their caregivers. Now, one of the biggest benefits of the Truealta platform is that this is available 24/7. It's not like if you're struggling with something and it's 2 o'clock in the morning, you can't pick up a phone and call me because I'm not at work, but you can go on Truealta and it will have information on how to help with a difficult behavior, some things that you can think through, or if you're struggling with a more in-depth behavior situation, then they also have teeth of snow videos within the Truealta platform that you can access. Really good option there. And again, it is a free service that's available, and you can sign up through our website, m4a.org, under the Alabama Cares page. Next up, we have T-Care. What we have found, and I say we, I wasn't part of the research team, but what researchers have found is that caregiver burnout is not necessarily determined solely by the physical activities of care, meaning that, well, if I only have to help with shopping, I'm at less of a risk of burnout than if I also have to help with baths or things of that nature. The real issue that is determining burnout is the change of identity from being a loving relative to a full-time caregiver. And what they're calling that is identity discrepancy. The first time a family caregiver sees themselves as a caregiver first and a family member second. Now, this is a program that is most commonly found under Jennifer's platform with the PANDA program, but we also use it in Alabama Cares. If there's a situation where you're really struggling and really stressed out and you're wanting some more in-depth information. And it's basically a questionnaire that you'll complete, and that will help us know how to better provide you with tools for your caregiving journey. We also have seminars, and these are in-person seminars as well as virtual seminars. It's capable of being a hybrid seminar as well, meaning some participants could be in person and some could be virtual. There is a caregiver stress busting dementia specific program, and then a caregiver stress busting chronic illness program. I'm seeing a lot of professionals as our participants in this. So what I would like to encourage us, caregiver stress busting program is a 9-week course, and each course meets one time a week. Each course is roughly an hour and a half. And a lot of us are already in our heads thinking, an hour and a half is a lot, an hour and a half is a lot, an hour and a half is a lot. And it is a lot, but what I think we as professionals do is we figure out how to support and accommodate caregivers being able to take that hour and a half for these 9 weeks, because what we are seeing is that self-care, which is what stress busting programs teach, self-care is not a luxury. It is a necessity that if you want to be able to be successful in your caregiving journey, and by success, I mean, if you want to be able to endure longer and keep your loved one at home longer and be able to endure without compromising your own physical, mental, emotional health, then you need to prioritize this self-care, which is what stress busting is going to encourage. So on our end, whatever works for your community, that's something that we want to start having some hard conversations about. How do we support caregivers so that they can engage in learning tools for self-care? Our community partners, these are fantastic partners within our community. Alabama Lifespan Respite, they provide a ton of caregiver education opportunities that are both live and maintained on their website, similar to what Alabama Cares and Panda do with our coffee breaks. We post those to our website after the fact. They also, depending on funding, can do some limited respite stipends. And again, it's as available, and you can reach out to them at their website to get more information on that. Alzheimer's of Central Alabama is another one of our local partners. They serve basically the swath of counties across the middle of Alabama, and they have educational materials, support groups, as well as scholarships for incontinence products. And jumping back up to Alabama Lifespan Respite, Alabama Lifespan Respite also has a library that they can work with you on, letting you check out adaptive equipment to see if it's right for your loved one before you go out and purchase that device. But back to Alzheimer's of Central Alabama, they have the incontinence scholarship, which allows you to have a stipend for assistance with incontinence product without having to be a part of a program like Alabama Cares. Asbury United Methodist Church and their Anchor Ministry. The Anchor Ministry is actually an adult daycare. They're looking, now that the pandemic is over, they're looking at getting opened back up. I know summer of this year was their goal, so they may have already started. Jennifer might have some more information on that.
They opened, Crystal, they opened last week.
Oh, yay, they opened last week. That is fantastic news. And they also have a support group that meets during the time where the loved ones are actually at the adult daycare. Now, Alzheimer's Association, this is another one of our partners. They do a lot of training, a lot of research, fundraising, and things of that nature. Very knowledgeable. If you want to get some information on Alzheimer's and the progress with that, this is a good place to go, as well as links to some additional resources that may be new that we haven't found out about yet. One of the ones that I am most excited about, and this is just because it's been so helpful to me, we've partnered with Dr. Rita Jablonski, Dementia-Centric Solutions. She's the head person over UAB's nursing program as well, and she's put together some training videos that specifically reach out to our professional caregivers. And if I'm not mistaken, Panda Project has required their direct service providers to review these videos with all of their workers so that their workers will understand correct information and tools to deal with individuals who are experiencing dementia symptoms that are more effective than what they may have been taught by just by virtue of having grown up with elderly people, some of whom have dementia and things of that nature. So just some more reliable information. And if you are a family caregiver, you can also view these. These are all on our website as well. Now, Dementia Friendly Alabama. This is an initiative that covers the whole state, and Jeremy and Robin are actually involved a little bit more with this program than I am, especially as it relates to trainings for first responders and creating dementia-friendly communities. So really good initiative here. And if you're on our newsletter list and you've seen the little flyer about robotic companion pets, the ones that we're working with right now are actually funded through a grant from the Dementia Friendly Alabama program. So an excellent resource, not only for individual family caregivers to get information, but also for professional communities to get information. So I ran through all of that really, really quickly, so we would have tons of opportunity for questions. So let's open it up and see who has questions. If you're joining us on the webinar, you can put them in the chat function. And are we live on Facebook too, Jennifer?
We are.
Okay, and if you're joining us live on Facebook, you can type that in the Facebook comment section. I guess one thing I should probably go ahead.
I don't see any offhand on Facebook.
Okay. I was going to say one thing that I didn't put on there was a card specifically or a slide specifically about me, because I mean, that felt a little awkward, but with being the caregiver interventionist, my main focus is leading support groups that right now are still virtual, but we're looking at getting those back in an in-person format, hopefully in the fall, as well as meeting one-on-one with caregivers who are struggling if they're in need of some additional support outside of accessing Truealta or the training videos from Dr. Jablonski and those kind of things.
Okay, does anybody have any questions? Or do you need some ideas? Or maybe if you're struggling as a caregiver, since we have Crystal Whitehead's full attention this morning.
I was gonna add too, Robin, with the videos that Crystal's referring to with Dr. Jablonski. I mean, she's a wealth of knowledge, and she does a really, really good job of breaking it down in layman's terms and giving really great examples. So highly recommend watching those because it's really useful, and of course they're free. So
I also want to add that there is a short little quiz after each video, and if you complete all 6 of those, we will email you a certificate for completing that as well.
And when Jeremy and I train on dementia friendly for first responders, Jeremy found these really great, very short UCLA videos. I wish we had one available since we do have some time this morning. They're really, really good. And it just kind of shows it's like real scenes, as, you know, like the lady won't get out of bed and then how they're just based on the caregiver's approach to communicating with the loved one, how it really makes a difference. So, I mean, I wish, Jeremy, we would have thought probably of playing that.
Let me stop sharing my screen, Jeremy, if you want to pull
that's what I was
those
gonna
up.
say. I could pull that up real quick. We'll kind of give you guys a quick little, and these two are also, these are also free.
My mother's been waking up in the middle of the night and seeing things in her room that aren't actually there. We're both exhausted during the day because we're not getting enough sleep at night. Good night, Mom.
Honey, help me.
What's wrong, Mom?
There's an evil man in the room.
Mom, please. There's nobody here. No one's here. Go back to bed. Come on. Look, there's nobody here. All right, go back to bed. You've got a big day tomorrow. Come on. Good night, Mom.
A person with dementia may experience hallucinations when the disease affects the regions of the brain that are responsible for interpreting sights and sounds. Hallucinations commonly involve seeing or hearing things that aren't there. They can transform ordinary, everyday experiences into frightening episodes. A good approach to reducing hallucinations is to identify and eliminate the objects or things that trigger them.
Honey, help me.
What's wrong, Mom?
There's an evil man in the room.
Oh, really? Let me take care of it. Come on. It's okay. Oh, I see. Okay, come on. Come on, I'll take care of it. Now you stay out here. Now he's gone, okay? I'll sit with you until you go to sleep, okay?
Okay.
You know, Mom, I think we should keep your coat rack outside so you have a place to keep your jackets when you come in.
Oh, okay, dear.
Okay? Okay. Good night.
Remember, patients experiencing hallucinations are having a difficult time interpreting their surroundings. Remain calm, reassuring, and try to identify what may be triggering the hallucinations. If hallucinations persist after trying to eliminate them, be sure to discuss this with their doctor. Here are a few tips on how to reduce hallucinations. Look around and try to see things through her eyes. What might cause her to misinterpret what she sees? Identify potential triggers such as open curtains, shadows, mirrors, or televisions left on. In the bedroom, use a nightlight to create a more peaceful sleeping environment. Always remember to remain calm and reassuring. Do not yell or scold her. Help her back into bed and reassure her that she is safe.
And there's their website there. It almost seems way too simple, but you know what we found is these simple little videos, they mean so much. So we definitely recommend, and of course, like we said, those are free. So we definitely recommend you guys checking those out.
We've had a couple of questions pop up while the video was playing. The first one, could you repeat your instructions for the certificate following the Dr. Jablonski videos, Jennifer?
All you have to do is go on the website, and I did put the link up for those videos in the chat, and complete each of the quizzes after, and then we will email you a certificate of completion.
Okay, and then the other question is whether or not we access insurance plans to refer to particular support groups. At this time, we're not accessing any of their insurance plans for support groups or any of our other services. These are free services, open-ended support groups, similar to what you would have with any of your AANA type groups or anything along those lines. So it's open-ended and you can be anonymous if that's your preference with that as well.
And there's also been several different initiatives that have kind of started because of COVID, like with every aspect of life. I mean, you're kind of forced into a kind of a new reality. So we're doing our best to adjust. And even before COVID, like I know that the Alzheimer's Foundation of America, they always had a call-in support group, but there's several support groups that have started because of COVID, whether that be, via phone or through Zoom. So we obviously highly encourage those types of resources as well. And another thing we didn't really add as far as just the tools, and again, these seem very simple, but what we've found with a lot of the caregivers that we work with is these simple things are really tools that they never really thought to use. I mean, they're right there in front of them that they never really thought to use. And one of those, or a couple of those, are like the YouTube video we just watched. A lot of TVs now either have one of two things, and that's that they're either a smart TV or they're either they've got an Apple Fire Stick or some kind of Roku system, and you can access those apps on the TV. So a lot of times, when we're talking with caregivers, they're having a lot of trouble during the day trying to stay busy and think of things to do. And we always recommend that they use YouTube as a tool because it's free. Often you'll have commercials, but you can quickly skip through those. But for the most part, they're free. And there's so many old, you can pretty much find any song that's ever been created on YouTube, as well as TV shows and movies or clips. And that can just be a very useful tool, as well as a wealth of resources for individuals like Teepa Snow. And that's TEEPA, and then snow, like the snow that falls outside. She's also a wealth of knowledge, but there's enormous amount of videos that are out there that can really help provide that free tool for caregivers to use to be able to hopefully help reduce that frustration that they may be encountering working with their loved one. And also with mentioning Teepa Snow, she's on pretty much every platform. I know that every day, I think I've liked her page on my personal Facebook page, but every day I'll get a notification from her group that they host live Q&A sessions every single day on Facebook. So there's a ton of resources, like I said, that have really been implemented because of the COVID pandemic that's kind of forced us into a new reality.
And in the chat section, Ms. Carlette has put in there, if the initial question was actually about the CEU certificate, that cannot be completed on your cell phone. You'll actually have to have a laptop, desktop, or tablet, something along those lines, to be able to complete her CEU survey and verification. So heads up on that one. One of the things, and Jeremy has kind of mentioned this, and it was mentioned a little bit in the video, the biggest challenge for caregivers, especially caring for those with dementia, is you don't just get to be a caregiver. You also are required to be a detective. We as caregivers are providing care to someone who has a failing organ, like kidney failure or liver failure or any other organ that is dying. With dementia, sections of the brain are dying, and as those of us who are unimpaired, that is something that we are, as the unimpaired individual, tasked with helping our care recipient, meaning that we need to connect with them, because at a certain stage in dementia, they may no longer remember who we are and how we're related to them. So if we are asking them to let us help them take a shower, or let us help them go to the bathroom, or let us help them clean the house. Would you want some random stranger coming to help you go to the bathroom? Would you want a random stranger watching you undress? So we need to make the connections with the individuals for which we're caring, and we need to assess what's going on with that intervention, with that individual. Is the situation that we're in a response to them misperceiving a situation? Am I trying to reach out to brush something off of their shirt because they spilled crumbs on their shirt, but they forgot in a split second who I was, and now I'm some creepy lady who's trying to reach out and grab their breast? Then obviously they're going to scream and yell and pitch a fit because they don't know me and I can't touch them that way. So, you know, we have to look with our unimpaired brains at the situations and then respond, not react, but respond based on based on the information that they are communicating to us. And then we evaluate whether or not the way we responded was helpful, or if we need to come back and try something again. And then when we figure out something that works, because all caregivers, again, self-care is not a luxury, it's a necessity. When we are taking breaks, we need to share this information with somebody. We need to share that, okay, mom's going to be really agitated come 3 o'clock because she's most probably going to think it's time to pick the kids up from school. So if you'll get her involved in, I don't know, a crochet project or a sewing project or a game show that came on after the kids were already home and they were doing their homework before that time frame comes around, then she's less likely to be agitated. So it's really all about just being a detective, finding out what works and sharing what works. And instead of reacting emotionally to a situation, which, trust me, it's going to be very, very hard. I get it, because they may dog cuss you up one side and down the other because they think that you're their ex-husband or their ex-wife who cheated on them or something like that. It's going to hurt. But again, we are the ones with brain functioning that is not damaged. So we are the ones that get to make the choice to respond and not react in an emotional fashion. And if there's something that you're struggling with and it is beyond you, it is okay to reach out and ask for help. Peer support groups are fantastic because you have other people who have gone through similar situations, and together y'all can kind of discuss that, not to mention that you have someone who can commiserate with you. It's also a valid option to reach out to a professional like our ombudsman and discuss what is the reality of placing a loved one in an assisted living facility, a memory care facility, or a nursing home, because we've all made promises never to place our loved ones in these facilities. But sometimes we reach a point where the best thing that we can do for our loved ones, especially when we've reached the point where their care needs are beyond what we can provide, even if we hire people to come into the home, when their care needs reach that level, then that's a conversation that we need to have. We need to love them enough to get them the help they need, even if the help they need isn't in the setting where they initially said they wanted it. But, you know, just things to think about. And always remember, as a caregiver, to give yourself grace. You don't expect anybody else in your life to be perfect. So we shouldn't expect ourselves to be perfect. There will be days that we get all of our tasks completed. There will be days that we don't get all of our tasks completed, and we just do the best we can in that day. So that's the end of my soliloquy.
I agree. And I did want to add to Crystal too, a couple of things I don't know that we've mentioned, just in general, just tools and just de-stressing and trying to kind of, you know, equipping caregivers with as many tools to have in their toolbox as possible. One of the things that our agency does, we also have what's called a Project Life Connect. A lot of our staff, whether that's our Medicaid waiver program or Alabama Cares program, our senior nutrition program, we've distributed thousands of these things across our 5-county region in particular. But if you're not familiar, and I wish I had a picture, I'm actually having some issues getting on our server right now. But that's one of the greatest tools that we've had, and it's really not costed us a ton of money. But basically, what it is, if you've never seen it or if you've never heard of, for example, the Yellow Dot program, which is more for a vehicle, our Project Life Connect program is basically a red folder that has a flap that you can put. We typically put a few informational cards in there, things like their medications list, their preferred hospital, their emergency contact, as well as some other things that, you know, that might be useful. But the idea is that whenever we are training first responders or training the community in general, we let them know about these Project Life Connects, because it can literally be the difference between life and death. And what it does is it goes on the refrigerator or anything metal, because it's got two little strips of magnet on the back of them, and they put that information on there. So especially in the case of a caregiver involved with, you know, caring for their loved one has had an episode, we've had to call 911. That's one less thing for that caregiver to have to think about, because they can literally grab that red folder off the refrigerator and we're going to the hospital. So those seconds mean a ton, you know, in an emergency situation. So if you've got a situation like that, thank you, Jennifer, for pulling that up. If you've got a situation that you're encountering that you think might benefit, these are free. We get sponsors, as you see there, some of our in-house programs, and even AARP has sponsored those. So if you encounter a family, or if you would like for your agency, I see that there's a lot of professionals on here as well. If your agency, would like to have some of these to pass out, especially within our 5-county region, then that's always available through our agency as well. I also, Jennifer, I'm going to try to share this real quick to kind of give everybody an example. I know that Crystal's done a really great job of touching on caregiving in general, but even more so because we know that individuals who are caring for a loved one with a dementia-related diagnosis or any kind of cognitive impairment can really be demanding, to say the least. And so I did want to review over. I will make a disclaimer: this is not our picture. This is just a Google search, but you can do your own Google search if you want to kind of see what the prices of some of these run, because they can get pretty high up there. But what this is a fidget quill. This is a very simple thing, and it's a very impactful thing. What it is basically just a lap quilt that has different, whether it's, as you see there at the bottom, the little, I think those are hairbands or wristbands that people used to wear, keychains. There's also buttons, and there's some fabric. So it just gives you different textures, different feelings. And that may mean something completely different for the person you're caring for than you or I. That specific touch and that feeling may take them back to a specific time in their life, and hopefully, brings about a positive impact there. But we see a lot of people that use these. If you have a loved one who is fidgeting a lot, I think these are also used as well with individuals living on the autism spectrum. So this is a very impactful tool that doesn't really cost a lot of money. Robin had really, I think back in 2019, we kicked off an initiative for our office to partner with some local agencies. I know there was a bank that was involved. There was also, I think the Columbiana Senior Center was really big involved. But we would take donations for some of these fabrics, and those organizations kind of took it upon themselves to create these for us on our behalf to give to the community. So we were able to provide over 100 of these to the community for free. And I know, like we've already said, there's a lot of you guys that are professionals on here, organizations. So if that's something that you guys are looking to take on as a group project, we would love to have that as well. I know that we were kind of we had a little bit of a roadblock, obviously, in 2020. So that kind of shut down the senior centers, kind of hurt some of the partnerships that we had there as far as their ability to do it. So I know that we're probably looking to kick that back off within the next few months, year, to hopefully get this initiative started again, because it was really great. But we've just, like I said, we were kind of hit a few roadblocks there. But I think we probably still have some of these at the office. So if you've got anybody that you encounter, or you personally have someone that you think would benefit from something like this, they're at most about $40 on Amazon, Etsy, places like that. So it can be a really useful tool.
Yeah, and Jeremy, I just wanted to add real quick. What we did is we created a big poster, and then the Chelsea Community Center, they actually, for 4, 5, 6 months, they have a lot of people that frequent that community center, and they donated all the little goodies that they sewed on. And then the Columbiana Senior Center and the BBVA Bank in Birmingham headquarters, they also are seamstresses, volunteers. So it was just a wonderful partnership. And I know Ryan Leonard, our ombudsman, did distribute a lot of these, but it really does keep people with Alzheimer's calm. So, and we do have some left over at our office.
And for sure, I mean, ours are pretty generic, but if you're, out of 50 people that we have on this webinar, and the hundreds that are probably watching or will watch the replay of this on our YouTube channel, I mean, the sky's the limit with these. We've seen people take like photos and kind of instill them into, like, there may be like a clear window that they sew on out of plastic, and they'll change out the picture occasionally. And we've seen where if there's a farmer, there may be some John Deere logos and just different things like that you can really make it tailored to the person that you're caring for. So ours are pretty generic, but just a really useful tool. Again, anytime you can get a useful tool that's free, that's always a great thing to do. Now, with of course, with the fidget quills, there may take a little bit of, especially if you're looking to buy one or do it on your own, but still a very inexpensive way to be able to combat some of the problems that you may be dealing with. Robin, did we have a few minutes? I didn't know. I know Crystal had, she had a little bit of an opportunity to kind of touch on Alabama Cares a little bit, but for many of the viewers, there's probably a lot of people who aren't really familiar. So I didn't know if we had a few minutes to go over that.
Oh yeah, please do, Jeremy.
Okay. All right. So I just wanted to briefly touch on the Alabama Cares program, especially for those who are fairly new to M4A and the Aging Network for Alabama. Kind of wanted to touch on that to see if we might be able to help in any way possible. But with the Alabama Cares program, it's a great program, but it also has some limitations. So we definitely want to make sure that we put the information out there to get as many families impacted as possible. But in short, Alabama Cares is a federally funded program that we receive funding for each fiscal year, which runs from October the 1st through September the 30th. And what that program's kind of purpose is to provide family caregivers who are unpaid caregivers with the support, or at least a temporary support that's needed to kind of help give them more support, more tools to kind of help with the situation that they're dealing with. Both Crystal and I both work with that program, and Alabama Cares provides services for 2 separate clients, but really 3 separate categories. And that is, and thank you, Jennifer, she just placed our webpage in the chat there, that we try to our best to keep as updated as possible. And it does a really good job of breaking down what the program is as well. But with Alabama Cares, we have two clients, really 2 categories, and that is our traditional caregiver. So that's an individual who's caring for a loved one 60 or older, or any age with a dementia-related diagnosis, and as well as what we call our older caregivers. There's my excellent face there that we're seeing on the screen. We've also got what's called an older relative, or what we refer to as our grandparents program. So for individuals who are informally raising a grandchild or a niece or nephew, basically they have legal custody in some format. We can also help provide, if that person's 55 and older, for an individual, caring for an individual 0 to 18. Now, when they get 19, it can be a parent that's caring for that individual, but there has to be a severe need, a severe, like a severe diagnosis, something like Down syndrome, cerebral palsy, et cetera. Now, the types of services, Jennifer, if you want to scroll down just a little bit, the types of programs that we provide are there on the screen. There's 5 service categories. That's caregiver information, caregiver access assistance, general education. That Crystal plays a huge role in that with our program, as well as the two most sought after portions of our program, and that's temporary respite and supplemental supplies. So information, that's just what we're doing right now, general information for the community on, what our program is, what we do, different events in the community. We also have access assistance, which is basically case management. We serve hundreds of caregivers every year in some form or fashion, whether that's temporary respite services to just in general talking with them on the phone, or support groups, things like that. We also provide education, again, things like this. Crystal previously mentioned our coffee break series, which is what we partner with Miss Jennifer, who's on the phone with the Panda Project. It's very similar to Alabama Cares, but it's based in Shelby County specifically. But we partner together to do a monthly webinar where we bring on individuals to talk about food or gardening or whatever it is, to kind of help give caregivers a little bit of a break while also having something educational. But we also do things like health fairs and support groups and caregiver lunch and learns and different things like that to kind of help provide that education. Now, respite services, that's basically a temporary service that we bring services into the home to give the caregiver a little bit of a break if they're not really getting a ton of support and a break in the home. That helps them to really, like Crystal mentioned, kind of help care for the caregiver and re-energize their batteries, give them a little bit of a time away to kind of take that break. And then we also provide temporary supplemental supplies. So things like incontinence supplies, things like grab bars, just things like that that help ease the financial burden for the caregivers. Now, with that being said, and I'm sure we may have some questions come through on the Alabama Cares program, but the key factor there is that it is a temporary service. It's not really meant to be a long-term service program, unfortunately, but it is in place to help those with the highest needs first. So we do take that into consideration whenever we're trying to serve families, is we're really trying to serve those who, for any other reason might not have support, whether it be physically or financially. So we get an enormous amount of referrals for that program, especially through the pandemic. There's an enormous need in our communities right now, and we're trying our best to really try to serve as many people, as many families as possible to kind of provide that ever so much needed support. And like Crystal, like Jennifer mentioned with the coffee break as well, we also put our coffee break series on our YouTube channel. You see there's a clip of the last one that we just had, which was a very great informative webinar going over financial crimes and scams for older adults. We had the Alabama Securities Commission and the Alabama chapter of AARP. So we really encourage you guys to go and rewatch those. Crystal mentioned the Truealta program. We also place these in Truealta. So it's just it's a virtual way to continue learning there. So that's pretty much it for the Alabama Cares program. Kind of the key factors there is that it's a temporary program, and but we still provide things like case management, education. You don't necessarily have to be a registered caregiver to come to our support groups. That's free to the public. We do those virtually right now. There was a flyer there on our website. Crystal hosts those. She also sends out a weekly newsletter to our caregivers on our newsletter list, specifically tailored for caregivers. So if you're interested in any of that information, feel free to reach out to either Crystal, Whitehead, or myself, or you can just contact our agency and ask for us specifically, and we can definitely try to help you guys out. If you have any questions, Jennifer, I'll let you confirm this, but if there's any questions after this webinar, do they need to reach out to Robin specifically, or how do we need to approach that?
They can contact us at M4A.
Okay.
It's 205-670-5770.
All right. Well, I don't have anything left on my agenda here. So, Crystal, I don't know if you have anything else you want to add.
Nope, all good. I hope everybody has a great day, and maybe we will be fortunate enough to continue enjoying some of the sunshine that just showed up in my backyard.
Absolutely.
Thank you, everybody. Have a great day.